Yeah, I mean, I agreed to have this program here because this building serves as a community recreation and wellness center, along with being a climate resilience hub. So the organization is really thinking about wellness from a holistic perspective. And we think about health and are very passionate, particularly about preventative health. And so we actually do a lot of events like this often where we have what we call the Ask the Expert series, where we actually run preventative health screenings here on site. And so this fits in with what we do already. So it was an easy yes, but we were also connected through a resident, actually, had worked with the HEAL Collaborative through another initiative and referred Gabby and the team to us. And so that's how we got connected. This place has grown exponentially in the 2.5 years that it's existed. When I started in mid-2022, we had 80 members, and now we have 2,024, and the last time I checked. And so we've grown through word of mouth. And we don't run TV ads, we don't have billboards up. People tell their friends, their family, their communities to come here. And it's important to note that where we're situated on the east side of Detroit is a predominantly Black part of the city. So we're over 80% Black, and I can feel comfortable saying over 85% Black in the area that we serve. The Detroit area, especially metro area, is incredibly diverse. We have a lot of communities, Latino communities, folks from Bangladesh, lots of Yemeni folks, folks from the Arab world generally that are in other parts of the city. So it's a really diverse city, though quite separated at times in the neighborhoods. And so I think what happens is that in any community center, we start to see reflections of the city as a whole, and even each neighborhood being a microcosm of the city as a whole. But the area that we're situated in is predominantly African American. Yeah, I hope after this HEAL session about small cell lung cancer that folks, one, are inspired to think about this for themselves and their family and their loved ones, right? I think that there's the immediate impact that would say, have I talked to my doctor about this? Is this something that I've considered? Is this something that I should screen for? And I think that's like the first immediate trigger that I would hope happens. After that, I hope that what happens in this kind of like deepening of the impact is that then they might ask, what other preventative screenings might I get? Are there other things that I haven't thought about that early detection might help with? And then that also being further relationship with the doctor and healthcare providers. And then further, maybe like, I wonder if there's clinical trials for these things that I have. And like, is that something that I can get into? And then further, that it opens up these conversations amongst themselves, their community, and their loved ones about preventative health and about chronic conditions generally, that then there's a more open conversation so that we can start to alleviate these stigmas that then prevent people in the future from doing the same thing, right? So I hope that it has this longer, deeper impact, which I believe happens. Actually, I've seen the change in the community for these things start to slowly open up through the depth of relationship that we have with the community and the consistency of this type of programming, that it allows for this kind of curiosity and this question asking to happen. And so, yeah, I think just having that shift of thinking, of asking the questions, is what I hope is the impact. If I knew then what I knew now about small cell lung cancer and symptoms, I would encourage people to get more preventative screening when the list of symptoms that he had, when I saw those in people, especially older folks or folks that I know that were around smoking. And so in the future, that is something that I've even noticed a shift in myself already, just even in the planning of this event, to say like, have you considered getting a screening for lung cancer, and just having that be part of the conversation. And so these are, I think, what can especially happen to Black people, and I think Black women even further, is that our symptoms get isolated by ourselves and by our practitioners. They're not seen as being one cohesive thing, which is part of why we don't get the treatment that we deserve. And so just knowing how all of these symptoms are connected to lung cancer makes me more aware and would lead me to ask more questions that even shoulder and neck pain could be something that would prompt us to go get lung cancer screening.